As one real example, Jennifer, that we've been that has come up a couple of times this week. In our strategic plan, you'll see that we and really youth and families have asked us to prioritize expansion of drop-in centers, including third spaces. When we talk about third spaces, we talk about libraries, we talk about shopping malls, right? And Jennifer, I know you do fund some rural libraries,
Mhm.
right?
Right.
And I think that's like, is that a third space or is that like buying books for anybody in the community who maybe
No.
doesn't have complex needs, you know? So those are some of the, I don't need you to answer, but like those are like some of the questions that I think are going to come up about like how do we ensure that these dollars are really getting to the kids that they're intended? So,
Yeah. And I hear you with that. And I hear that you've heard from youth and families that have informed the strategic plan. And I would say that as using a systemic care lens, I need to be responsive to the youth and families in my communities
mm-hmm,
and hear from them. And that
mm-hmm,
and that's what we do.
mm-hmm,
And we hear over and over about respite, the need for respite. And I think across Oregon, we hear that, and
mm-hmm,
we've communicated that with
mm-hmm.
state partners, and yet, there's no respite. So and the other thing with this is, yes, we can adapt the strategic plan in our communities, but we really have to be responsive again to the needs and the capacity of our communities. And, for example, we have a really big initiative underway, and it's trying to support youth in schools with behavioral health services. It's a huge cross-sector work group, got a lot of buy-in from leadership and community partners. And is that reflected? Is that one of the action items in the state SOCAC implementation plan? I'm not sure.
It
It's
is, yeah.
talking about,
It is.
would it? Okay.
It is, yeah. Both school-based services and respite are
That's
going to
its
be
respite.
prioritized actions starting next year.
Okay, perfect.
Yeah.
Yeah, I just really want to make sure that, I mean, systemic care is a bottom-up approach. It's not, hey, these are our ideas from outside of your community, implement them. It's like it has to be bottom up for it to work.
In terms of like communities, when you say bottom up, are you meaning like from communities?
Yes, in
Yeah.
terms of like who, what are we going to do? What direction are we going to take? That has to come from the community. It can't come from an outside agency saying, "Hey, this is what we think you ought to do.
Mm-hmm.
These are the solutions to your problems."
Mm-hmm.
Because that's the process that led to the problems that the system of care was developed um, to try to solve.
Yeah. Yeah, again, so I mean, we got a couple of years to kind of navigate through these conversations, right? Philosophically, I think, some of us are coming from different places, right? And different understandings, and our communities at large are coming from different um places as it terms to like in terms of understanding of what system of care is and what it means and who it's for and what it's about. And so I think philosophically, right, you will see a shift. We'll do that together. Nothing is changing immediately. We've got 2 years to get there and figure that out. We don't have all the answers yet, right? These are really nuanced questions and conversations, right? And so I don't want anyone to get like in a panic about it. We're really happy and excited about the work that you've got planned over the next 2 years. Um, and some changes will be happening. So and Danny, I just want to call out your comment because I think it's helpful. This is definitely helpful and helps and tells me I need to reshape our future in the Central Oregon system of care because, quote, multi-system involved has thus far been seen through the lens of any youth service, medical education, behavioral health, etc. And this shows us that we need to narrow that scope a little, I guess. And that is exactly kind of like the point that we're trying to get to, right? There's a lot of needs and there's a lot of great work that happens in the prevention space, right? And we are not those people. We can let them do that work. I mean, Selby, you kind of called this out, right? Like you provided some comment at the Tuesday council meeting about like we didn't see anything related to 0 to 5 in the strategic plan. We have questions about that. And I think you heard very clearly from Adam Rodakowski that like, yeah, we're not going to focus on 0 to 5 because there's a lot of great people who are doing that, a lot of great agencies, a lot of great efforts. We're going to let them lead on that work because what we're called to do is really address the needs of youth who are older than that and who haven't been served by those maybe preventative services that we hope to have been in place. So,
I,
okay,
I want to say I like that, Christy. I like narrowing the scope because I feel like when you're trying to do everything for everyone, you end up not being able to do anything for anyone. So I appreciate the focus on multi-system involved youth.
exactly, exactly. Thank you, Jennifer. Okay. Any other questions about question number 3? Okay. Question number 4. This is the same for those of you using these funds for agile funding. No changes here. All right. The next
Can I
page.
ask,
Oh,
wait, Christy, can I
yes.
ask a question about that though?
Yes.
Because, and again, I don't have any, like, I have zero problems with like like what you're asking and stuff. I think it's perfectly great. But you talk about food and transportation being another, but it's on, so we're allowed to do it within agile services for our multi-system involved youth.
Correct. Yes. And that
Correct.
really is
Okay.
the intent, right?
Perfect.
Yes. And then like agile funds, flexible funds, this is
Mhm.
like a best practice for system of care, right? This is part of like the nationally recognized model. Um, and ensuring that those dollars in the way that you are distributing them are getting to the kids who really need them most, right? So,
No, I like that. I just wanted to make sure because you had just said food and, housing wasn't something that we could do. And then but it is on our agile fund and my communities really do like the agile funding. And they are, and we have a way to determine multi-system involved youth. So for
great.
that.
Perfect. Yeah. So I think like the example here, Chris, is like giving a food voucher to a family who's had their work interrupted because their kid was in the hospital or in a residential, 100% appropriate. Giving grant dollars to your food bank because there's a lot of need in the community right now, that's where we're going to raise our eyebrows a little bit.
Yeah. Nope. That's
Does that
totally
make
fine.
sense? Okay.
Yep.
Selby.
I think you sort of answered my question. I feel like the conversation's getting a little bit mixed about like the dollars you've already spent on some things, right? And then your dollars for the next 2 years. And then we've even brought up the 27 to 29 cycle. And so for me, I feel like the conversation's getting a little convoluted. So it's like whatever, the money we spent in agile funding in my region is spent. But then, I'm thinking, well, okay, do I need to make changes to what I think I'm covered on the multi-system involved kids angle, but I'm like, do I need to go to the local, groups that are implementing agile funding and like put new restrictions or something on them for this 25 to 27 grant cycle? But it sounds like we can operate our current grants as proposed, and it's really starting 3 years from now
Yes.
we should be looking at this new format and honing in. But I was kind of feeling like I'm things were getting a little squirrely for me because we've brought up 3 grant
Yes.
cycles in the same conversation. So
Yes.
so yeah. So okay. So like I
Yes.
said,
Sorry, Selby. I agree. We're talking about kind of like 6 years of time in history and changes in between those things. So I think, but yes, you nailed it.
And Chris,
Okay.
I have a question about agile funding. So, so we spend a lot on housing and utilities. That's just
hmm
how it's playing out.
hmm hmm
And so I'm just wondering how you feel about that.
Yeah, I mean, I think, I think it's fine. That's, as long as those dollars are going to youth with the most complex needs in your community, that's what they're there for. I think you will see, though, in these optional questions, that at the same time, we also hope that you are exploring and trying to leverage other dollars, right? We know that $200,000 is not a lot of money. We're probably not going to see significant increases in our budget in the next years, Anna, correct me if I'm wrong, right? So when we think about these $200,000 and the most effective way to use them, if you can think about other dollars that would pay for housing in your community. So health related social needs is a major source of funding, albeit it's been real complicated and messy to access, right? But like, are you in conversations with your HRSM partners? Are you in conversations with your CCO about how they're administering flex funds or share dollars, right? So it's just like, are you having conversation? Are you seeking out other funding sources for housing in your community? If you are, and like this is what, you tried to exhaust those things first before you use the grant, that's all we're asking for. You don't have to, right? I think in a lot of like federal dollars, they'll say like Medicaid funds are the funds of last resort, which forces people to make sure that they've spent other funds before using these grant dollars. We don't have that here, right? And at the same time, like if there are other dollars that you can use in your community to meet a housing need, um, then maybe you can do that. Does that answer your question, Jennifer?
I guess it does. I mean, when I look at this, I kind of feel like we just play kind of whack-a-mole with needs in our community. So if we can find funding for one type of service or gap, it's like, well, now there's another gap. And like you said, that $200,000 is a very small amount to try to meet, the many, many needs that we have. And so, for example, the CCO I work for, they are contracting for the first time with our peer organizations. So they're contracting, which is amazing. And they also are contracting with Youth Era to stand up a youth advisory council. So that's been amazing. But every year, like we were just going through that first year with Youth Era, and it's like, okay, is there money? Is there money? And so yes, there's money. Okay, we get Youth Era for another year, but it doesn't, like when you say sustainable, to me, it just kind of feels like we're still kind of wringing our, like, yes, we found some funding and we're good for a year, but is this completely sustainable? I mean,
Yeah. Yeah. And part of some of the actions that have been prioritized in the state system of care strategic plan will be about doing some fiscal sustainability planning. Kind of details yet to be determined, but hoping really that some of you will be able to participate and kind of learn from all of that. We'll do that together. But yeah, we know this is not enough money. We know there's a lot of shifting in in our state in terms of dollars. So again, these are optional questions. You don't have to answer them if you want to, though. How are you planning for sustainability in programs and services within your system of care? And this is really trying to get you to think a little bit about braided and blended funding. So describe efforts to leverage public and private resources such as Medicaid, student investment accounts, health-related services, in lieu of services share, foundations, etc. What support do you need to leverage those resources? So as a real example, I was on a call yesterday about school Medicaid services, right? So this is where school districts and ESDs can bill Medicaid for services they are delivering. And I asked specifically about whether or not peers had been identified as a potential provider type, right? It's typically paying for things like school psychologists, social workers, therapists, occupational therapists, speech pathologists, those kinds of nurses, right? And in fact, OHA is exploring how to include peers in those billable services. So Heather Howard, I was thinking specifically about your work. I don't know, because you're using your System of Care grant to pay for peers who are working in schools, right?
Yes. Yeah.
Yes.
Like youth outreach workers is what you're
Right.
talking about,
And
as well as
so,
student
right.
HPs. Yeah.
And do you know, are any of your schools billing Medicaid?
I don't, I can't say 100% that I know that answer, but I don't believe so.
Okay.
I don't think so either.
Okay. So this is like some of the that's just like one example. Sorry to call you out, but like this is one example, right? We're like, okay, well, if Medicaid can pay for those peers, then why are our little $200,000 paying for that time, right? And so, as a system of care, do you all have a role in bringing your CCO and your school districts to the table to figure out let's get you all plugged into billing Medicaid so then those dollars can pay for the peers and we can use these $200,000 for something else. That's just like one little example. Is that helpful to folks?
Yeah, and I just want to make another comment. I would, and I'm not sure, this is just what I'm thinking, but really, I feel like the systemic care grant, this is part of the importance of the systemic care grant in local communities is I feel like without having funded peer support and youth engagement through the systemic care grant, I'm not sure if the CCO would have seen the value of it to put these contracts in place. So in some ways, it's kind of like we're piloting something to show, hey, this is asked for, this is needed, and this can be successful. Will you then invest in this?
Yep, that's entirely one of the purposes of the grant money.
Mm-hmm. Yep, exactly. And we've seen several examples of how that seed money has really been able to leverage more sustainable funding sources. So that's a great example. All right. Selby, did you have a hand up?
Yeah, I have a lot of things coming up and I can't decide like what's part of the conversation towards 27, 29 grants and what's worthy of a comment now because it's recorded and I hope you take meeting minutes. But this just for me touches on this whole thing of, yes, what is the CCO commitment to system of care? Because in some counties, it's just giving $20,000 to an external contracted partner to run the system of care collaborative and then their commitment's done. In others, it's hiring a staff person full time inside the CCO. And I'll say, even for me, it's taken me 5+ years as a consistent person in this position to really develop the relationships in the CCO to start getting system of care recognized. And I just feel like I appreciate this question and I can respond to it. And I appreciate the direction we're trying to go. But sometimes I feel like there's confusion. Like, are we trying to run system of care like a 501(c)(3) nonprofit, or are we trying to just, be meeting facilitators and facilitate a collaborative of partners? Or how am I like individually charged within a CCO with a $2 billion budget to expand the service array? Like I am not engaged in the management of the Medicaid benefit. And so so I'm just going to put that out there as thoughts and questions for those discussions related to 27, 29 as we're kind of collaboratively thinking about where we need to go, because I'm just thinking like, again, if you hear us all the time talk about capacity and these kind of issues. And so I appreciate these questions, but I also feel like sometimes when maybe our answers come off as perhaps looking insufficient answers to some of these questions, that then, I don't know, sometimes you've also heard from us, sometimes people feel like there's judgment leveraged against us if we can't answer these questions to the fullness of what might be desired. So I think I'm just cycling through a lot of that, but thank you for the chance to put the questions out there for consideration for further discussion. Again, there's a more appropriate meeting time right now than this, but I appreciate it, like I said, taking note of those questions. Thank you.
Thanks, Selby. Yeah. And I think a lot of what you're getting to really lives in goal 4 of the strategic plan, right? We're going to try and transform this whole system. There's a lot of things that are going to change, and we're going to do that collectively with you, with community over the next 4 years. So we've got some time to figure out some answers to all those questions, Selby, but those are all very important and very relevant to what we're trying to do here. Okay, we're getting close to 10, so I'm going to try to kind of wrap this up and move us along if that's okay. Again, these are optional. You don't have to answer them. If you totally ignore them, that is totally fine. No one's going to judge you or think differently about you. Like, it's really okay. Like, we know you, everyone's very busy. If you're like, I got nothing to say on these, totally fine. And for those of you who are like, actually, I do have something to share, here's a spot for it. Okay. I think specifically question number 6, is there anything else you want to share about your region's accomplishments, including achievements not directly funded by this grant? So we know that these dollars really only speak to just some of the incredible things that you are all doing in your region. Okay. The questions above are really only about those $200,000. If you want to tell us about something else you're doing within your system of care that's not being paid directly by that grant, there's your space to do it. Okay. Again, optional. You could ignore those for the next 2 years. It's totally fine. And then finally, we'll have the same objectives question for you. This is not due till February 2028, which feels like 100 years from now. So, okay. Any final questions about the reporting template? Oh, I have one. Do you want me to add a question here as an optional? Like, is there anything from your 23 to 25 grant that you want to report out on? I think I'm just going to add it because some of you are amending for a little bit of time. So I think I'll just do that. If it applies to you, great. If not, you can ignore it. Okay. Let me make myself a note. Okay. Let's see here. Okay, a couple other things about the 25 to 27 grant. So you can submit your first invoice upon execution of that grant. So as those things get signed, I think Selby, maybe there's one or two grants that have been all signed by everybody. So as soon as they're signed, I will do my best to try and send that to you so you can get those invoices in.
The execution request is interesting because in our grant, it shows the new project period is starting in January. And like
Mhm.
HealthShare didn't want to invoice when we got the executed grant because they
That's
didn't
fine.
want to have money sitting on the books that's technically not for a project period that hasn't started. So
Yeah.
I'm sitting on it, but they're delaying the invoicing till mid-December, So
Okay.
it was
Okay.
just interesting. Like I was like, great, I'm going to start this process now because it takes forever. And then
Yeah.
still the financial from I guess the audit perspective and stuff, they are timing
Interesting.
um
Okay. Yeah, and I
they're
don't know
they're
if that's
timing it.
the same, if other folks have the same kind of anticipate the same barrier in terms of like requesting an invoice before the start date. Um, so hopefully that doesn't cause too much of a commotion. If not, I will be back at work January 2nd. So,
Now, I was telling all my partners anyway not to expect money till January,
okay.
just because I knew it was a long process. But now I'm kind of curious, like, well, if HealthShare is delaying the invoice slightly, we'll see. It's going to probably push their funding out a little bit farther.
Yeah.
I know
Yeah.
Clackamas County keeps saying, we need agile funding money so bad.
Oh,
I don't
see, yeah,
have
that's the
it.
thing, right?
I
Like
don't
if
have it.
that's a great
Yeah.
example, Selby, like agile funding it means like money in people's pockets. Like that's
Yeah.
something we don't
Yeah.
really want to wait on if we don't have to. Um, okay. So some of you, and I think Selby, you've been channeling a lot of these questions to us about the system of care infrastructure survey. More to come on that. I think that is something that we're going to want to do at some point in 2026. Um, Cody's going to be leading that work. We'll have lots of conversations with you about that. But I'm happy to answer any kind of immediate questions you all or concerns you all have. So basically, this is going to be an online survey. SOCAC will build it. We will send you links. Really, your responsibility here is to get responses from people in your region. We'll figure out kind of, how many responses that is. I'm sure there'll be some sort of requirements that you have, like, a certain number of youth, a certain number of families, certain providers that complete it. And that, again, we'll also have to figure out, for those of you who have larger regions, right? Some of you just have one county. That seems pretty straightforward. What happens if you have 12 counties, right? So again, we don't know the answers to that yet, but we will figure that all out. Your job will really just be getting those responses. SOCAC will be doing all of the analysis. We'll provide that data back to you. And more importantly, that data is going to serve as baseline data for some of the process measures in our strategic plan, and hopefully help you understand some of the needs and strengths in your regional systems as well. So, any questions about that or what that's going to look like? We're going to build that survey off of a national survey that was developed by the National Training and Technical Assistance Center. So I'm happy to drop that link or share it with you all if you haven't seen it. It's not going to be exactly that because, of course, we need to make it Oregon and make it a little bit more relevant to kind of what our system looks like, but it'll generally kind of feel similar. Okay. Anything else on this, folks? Okay. Um, do folks want to do a little breakout and just kind of share what you're excited about for your 25-27 grant? I don't know. I mean, I know you all kind of connect in other spaces. So if you feel like you've already talked about these things but if you are interested in kind of hearing what others are doing with these grant funds, I'm happy to move you into some breakout rooms for a few. Do folks want to do that? You all just want to peace out? How are you feeling?
Do some breakout rooms. Let's build some community. Just
Do
give me a
it.
few minutes. Let's do
Let's
it.
do it. It's not going to be forever. How about like
Yes. Let's
5 minutes?
hang out.
Thank
Let's hang
you.
out.
Thanks, Haley.
You're welcome. I made the
Hang
choice.
out.
Okay, go.
Okay, I'm gonna put you into rooms, couple of 2, 3 of you in each, and we'll come back in like 5 minutes. Sound good? Okay, have fun. And just talk about whatever you want to talk about. But if you want to talk about your grants for next year, what you're excited about, that would be great. Have fun.
McDonald's, I would only let my kids have a vanilla ice cream cone from McDonald's, and that was it. And then all three of them ended up having their very first jobs at McDonald's.
It all backfired. Isn't that
It
what
did.
happens? Yeah. Like the kids who can't watch any TV and then become like, yeah. Oh, parenting.
Well, first of all, they have the best French fries. Like, so
They
to
do.
be fair,
Oh,
to be fair,
100%.
they have the best French fries. It's because aren't they dipped in sugar and that sugar water and then fried, which is probably why they're so delicious and
They're
perfectly
injected
golden.
with fat before they're fried.
Great.
I heard they were soaked in hamburger grease.
When you
They're delicious.
McDonald's was also my
So
first.
many rumors.
And when you dump out the fries to like fill up the fry bins, at least in 1996 or whatever, when I worked there, like they would just leave like a grease smear on everything they touched. Like cold frozen fries were like just leaving. And that's why they're so delicious because they're just like potato infused with fat and salt and maybe sugar too.
They're
They're so
delicious.
good.
And I haven't
I'm
had
so
French
hungry.
fries from McDonald's in years, but they're delicious. Also, I remember at one point, my dad, like my kids didn't eat McDonald's either when they were little. And I remember having to go home and live with my parents, and I had to, my kids were really little. And so we went from being able to have like going to eat in restaurants to the only thing we could afford was once a month a McDonald's trip. And my dad was like really cranky and he's like, "You have a really whiny child." And I was like, "You have no concept of the uprooting that this child has experienced. And if he can have McDonald's once a month, he can have it."
We're gonna
because
do
it is bringing him joy.
Yep.
All right. Thanks for the little French fry break. That was fun. Um, uh, so we only got a few minutes, and I do would love to hear a few of your ideas about how you want to use these spaces next year. But were there any like one or two sharings from your breakouts, like something you're doing that you're really excited about, something you heard your colleague is doing that you're really excited about? What was like, oh my gosh, that is so rad that you're doing that with your grant funds. Anybody want to share something? Corinne.
Yeah, I was talking with Karen about some of the work that she's doing, and it sounded so cool that they have been doing a youth advisory council through the tribes that are associated with Calamith. And yeah, it just like really, we had like a pretty good discussion about like groups that are historically marginalized and how that could be like, and I guess this is like back to the philosophical question. So there's no like answer here and to like be followed. I don't expect that, but it's just like something that really made me reflect and think about this is like when we're talking about like another group that she said was happening was like this youth like LGBTQ group. And so we were just thinking about like how like what about the I don't know like societal systems that we create or like it like how like it doesn't feel good to deny people who are of these like historically marginalized spaces if they're not multi-system involved. And so it just, kind of we were processing that a little bit.
Hmm.
So anyway, no, not expecting like any kind of answer or anything, but just like
Mhm.
something that came up for us.
Mhm. Great. Thanks, Corinne, for sharing. Awesome work, Karen. Yeah, particularly around like tribal relationships, right? This is something we've talked about in this space, and something that I'd love for us to continue thinking about next year. Anyone else want to share something that you learned about or just you are excited about for your grant?
I'll share something that has nothing to do with our grants because we didn't talk about them. But I was with my dear friend Selby, and we share a CCO, and it's soon to become my only CCO. And Selby shared that she advocated for Lane County in a meeting with them. And that to me, Selby, oh my goodness, I'm not going to cry. But that means so much. And it really speaks to like the power of this connection because I think that's something we've all struggled with, whether it was 5 years ago when you started or if you're newer, but it's like explaining what the hell the system of care is, what it's about, who's involved. And sometimes it can be so isolating, right? And so this space and connecting with all of you, it like makes me feel less alone and less like I'm crazy in a way, like this makes sense. This is how it should go. So shout out to Selby, shout out to us advocating for each other and also like not quitting. Like this is hard work. So way to go, everybody. Go get a cookie. Great
Hmm.
job. Get some McDonald's fries.
Just don't think about it too hard about what's in it. That's great, Haley. Thank you for calling that out as like, just like such a great example, right? This is hard work. We're here to support each other. So thank you, Selby, for thinking of your fellow coordinators like you always do. And you got something to say too, it looks like.
I have been trying for several months to step back, but obviously this is my week for stepping forward. But I was also going to say, I think anytime Haley talks, I just feel better. So, um, no, I love bragging about, I finally got my interns. That was part of my 23-25 grant. So I'm one of those systems of care that has an extension because there was work assigned to the interns, and I just kind of left it there waiting for them to come. But I have two MPH interns that I'm precepting, and one of them is helping roll out our wellness room project, which was identified by youth who are multi-system involved, but I can't guarantee that every youth inside a school setting will be multi-system involved. So that's another question. But yeah, so that's rolling along nice, and we've met with a lot of nice schools and education partners and increasing our connection to education. And I think we're on the verge of identifying our three schools we want to work with. So I'm really excited about those wellness room projects rolling out. And the second one is doing all things barrier, which has been a little bit harder to define precisely what that looks like for her. But she looked at our barriers from 2020 to 2023, and she did a historical update on all of them, like was legislation or policies or anything passed or changed around those barriers. And then on our 24, 25 barriers, working on some kind of white paper is the term she likes to use, and you will have charts and descriptions and like some overall picture. And again, our barriers are sort of randomly submitted by whoever happens to know we have this process. But anyway, she's doing a big analysis and helping with barrier work. So just super excited to have them in place and feel like these important but projects that were really hard to get to are actually moving forward now with pretty good speed. So there's that. So
That's
again, that's
great.
the old grant, but excited anyway.
Yeah, that's great, Selby. I know that's been on the wish list for a long time, so it's awesome to see um that happening and those rooms getting built. That's really cool. Okay, we got just 10 minutes left, and I do want to hear your thoughts about what to do with these spaces for the next biennium. So they have been scheduled quarterly for an hour and a half. We've touched on a variety of topics. When we asked you about, like, oh, what do you think about this space? We got kind of like mixed results. So, um, would love to hear your thoughts about what to do with these spaces, both like how frequent, um, and like how long, do we need the hour and a half? It feels like we fill the time, but like I'm happy to make it an hour. Do you want to continue quarterly? Maybe 3 times a year, twice a year? And then what do you want to talk about? Would be kind of like my third question for you. Some additional context you might want to think about is that we are no longer going to have a grants committee. That committee has sunset. Um, Not quite sure what system of care grants are going to look like within our new implementation structure. That's kind of to be determined. But I'd say it's very unlikely that we're going to have a committee that is specific to grants. Um, so for those of you who are participated, we've kind of touched on this work in that space. That's no longer going to be a space that we'll be talking about these particular dollars in. And I think the other thing to note is that there's likely going to be some changes with the monthly learning collaborative series as well. System of Care Advisory Council has taken a big pause kind of in the first few months. We've got a lot of kind of cleaning house to do, organizing with our new strategic plan. And there's probably going to be some changes with that learning collaborative series too. So that being said, as it relates to this meeting, what are your ideas? What has been helpful as it relates to your grants? I mean, it seems like given some of the changes that we're going to be thinking about for the 27, 29, um, that might be something we want to talk about. We're going to have this infrastructure survey. We could also talk about that in this space. Those are just a couple of ideas, but I'm open. I'd love to hear your thoughts.
I love hearing how other people are using the system of care grant
Okay.
because it sparks. I mean, it's just like, that's what system of care work is. You find out what's working well in other communities and then you try to replicate it. So I love hearing all the great things that other people are doing.
Great.
Then if you're not having a grants committee to talk about the grants, I guess all of those discussions around what the grant is going to look like moving forward or reporting or those type of questions. I mean, we could talk about that at this meeting as well, I suppose.
Great. Thanks, Jennifer. Other
I
ideas?
I just want to clarify, it's not like we're not going to have a committee that talks about grants. It just won't be a committee that only does grants. So it will be a committee that's looking at like investments for instance, right? Like what is the money work that is the system of care's responsibility and grants being a component of that? Or it might be an outcomes committee, right? Like we haven't figured that out yet. It will live somewhere. It just won't be like all we do in this meeting is talk about grants. And so we come up with work for you all to do because we don't have enough of our own work in this committee space, but it feels like we need to fill an hour of time, right? So trying to really sort of right size the workloads for the different committee spaces. So Just to clarify, like we're going to keep talking about them, just not as the sole purpose of one of the committees.
I think also since, strategic planning is going to be such a big part of, the next year or so, as if it hasn't already been for you guys, right? And with those of us doing different things with the allotment with our own dollars, right? Like having some time that's catered to that. I know that I'm gonna be brand new in the process with my SOC starting in January. And so I would almost encourage that be like a first place to start in case anybody else is in the same boat or just because I'm selfish. So starting with that would be great.
Great. Great suggestion, Haley. Thank you. The chat. Corinne also loves hearing what other folks are doing with their grant. Taylor Jane, holding the space is beneficial. Great. Selby, if SOCAC is hoping locals start to explore braided and blended funding, technical assistance about talking with partners, budget cycles, grant writing skills could be helpful. So a little bit about like how to leverage those additional funds. Great idea. Selby, you also said wondering if the YDO Youth Development Oregon convening formats could provide any inspiration of what to do with the space. Can you say a little bit more about your idea there?
Just that they are another funder, right, with lots of grantees, and they're trying to bring all of their grantees, which are statewide, and again, they travel, which we might not be able to, but they bring them together in large groups. I don't know how often they're doing it, but to, again, meet certain goals they have. Sometimes it's just literally around maybe their grant and implementation. I know some of us went and spoke kind of around this idea of behavioral health access for their grantees and how their grantees doing that. I don't know. I just thought, so they have different purposes, I think, for the different convenings. But anyway, just kind of wondering, I don't know if it would provide inspiration for how they're organizing or going about their planning, if there's something to look there and see how they're doing it. Because I think it's very similar where they have a diverse group of grantees across the state and they're trying to unite them around a common theme or idea. I don't know. That's it. Just like wondering what their thought process is over there and if it would be of, thought provoking for you all.
Yeah, that's a great call out, Selby. I personally haven't had kind of much connection with YDO as of late. I did sat on as like a reviewer for their last round of grants, which was very interesting. Anna, you just recently presented, I think, to YDO about strategic plan.
Yeah, both they had ADPC and us present sort of back to back at their convening that was this week, actually. They did one a day in-person day and then a remote day, and we presented at the remote day yesterday, I think.
Yeah. So definitely like a really important partner. I think part of our strategic plan is really like looking at all the various partners who are working in the youth space in Oregon and maybe trying to like prioritize. There's some work around like potentially establishing like agreements or memorandums of understanding. I could imagine us doing something like that with YDO. I do agree that those like attending in-person convenings was really fun, at least for the ones that I was able to attend. We don't have any plans to like do that in the near future, but I'm really open to the conversation. And I think in person is so lovely and so important. It is hard for our little team of five to coordinate and organize all of that, but we always love an invite. So if you've got a meeting or a convening or a conference or something you want us to attend, like we love the invites and really try to prioritize those. And again, in the strategic plan, we are planning to do like a road show. So in-person meetings with your partners, with your grantees. So all of that is kind of things that we are really hoping to do. That probably won't happen until like early 2027. But it is definitely something on the list. So I know Tracy says I now participate in a collaborative that they fund. And so you're connecting with them with YDO. That's great. That's
I
awesome.
think that's Selby, not me.
Oh, that was Selby? Oh, for some reason I keep saying TC. Oh, Tri-County. That's what it stands for. Okay. All right. These are all great ideas. I am seeing some agreement that quarterly is great and that works for folks. I will get something scheduled with a different Zoom link. So look for those. I will get you that final reporting template for you all to use. Um, and we'll look forward to your reports in January. Thank you so much. If you have any questions about where your grant agreement is and you're worried about it getting lost, please don't hesitate to reach out to me. I will be around for most of December. So, hi,
Can
Corinne.
I chat with you
Yeah,
really quick
yeah,
at the end of this
yes,
about
yes,
exactly that? Okay.
yes. Happy to hang out. Thanks, everybody. Hope you all have a great Thanksgiving. Thank you so much.
Thank you.
Good to see you
You
all.
too.
Bye. Hi.
Hi.
You want to stop recording, Anna?
Oh, yeah.